Did you know March is considered to be Better Your Eye Health Month? There is a good number of people out there who should be able to take that a bit more seriously, myself included. So no matter what your vision may be, you should be checking up on your peepers from time to time. One guy you can go to do it with is Dr. Bernitsky from here in Albuquerque. Doctor, good morning. Thanks for coming in.
Thanks for having me.
Eye health. We know it's important. Why so much?
Well, without your eyes, you're really going to have a lot of trouble in life. So
Yeah.
it is important to take care of them.
So what does it mean to so I used to wear glasses. I had a little bit of LASIK done. Do I still need to go to an eye doctor? For folks who've never had vision problems, they still need to go to an eye doctor once every couple of years just to get a checkup?
Absolutely. Yeah, there are some diseases of the eyes. Generally, the eyes are pretty good real-time feedback machines, and
Okay.
if you're seeing well and they feel okay, they're probably okay, but there are several exceptions to that. One of them is glaucoma, which has no symptoms until much later in the course of the disease when a lot of damage has already been done. The only way to detect that is to have an eye exam.
So if you do get those checkups, a doctor, an ophthalmologist such as yourself would be able to go ahead and detect that.
Absolutely.
Yeah, my mom had that, and she found it through just regular checkups on her eyes. Now, we've heard of LASIK. It's been around for a while. It's kind of the laser vision correction, but there's some new technology out there for folks who maybe weren't good candidates for some of the stuff that was used previously.
There is, and we're very excited. We just found out last week that the FDA has finally approved what's called the Toric ICL, and it's a implantable contact lens that can fix huge amounts of nearsightedness, but also astigmatism. That's the part. We've been doing the regular ICL for about 8 years now, and they've just approved the one that will also correct astigmatism. So that offers a chance for a lot of people that didn't have anything else.
So an implantable contact lens?
Yeah.
So it's pretty much just like a contact you permanently put in somebody's eye?
Yes, but it's inside the eye instead of out on the surface, so it's not subject to any of the problems with dry eyes or wind or allergies or the other things that bother people with contact lenses.
That's pretty incredible. Is that covered by insurance? How much does something like that cost?
It's not covered by insurance, and frankly, I'm not sure of the exact cost, but you can call our office and they can tell you about that.
Gotcha. Huh. So you pop that. Is it as quick as a LASIK surgery?
Yes, it is.
Wow.
Almost exactly the same time and basically the same experience for patients as having a LASIK.
What other developments have come along? I know people were, when LASIK first came out, 'cause that's the one you hear most about. Is that what kind of is the most popular form of vision correction these days?
Yeah, that's probably what we do more than anything. And that's continued to improve. You know, we've changed from doing the first step of it with a mechanical device with a blade in it to a laser, using a femtosecond laser. So that was a big leap in technology. And then the lasers themselves have just improved in terms of the scope of what they can do and how well they can do it.
Okay, here in Albuquerque, New Mexico, we're fortunate enough to have sunshine so much. Are sunglasses really helpful in protecting your eyes? Do they serve a purpose besides just trying to look cool when you go outside?
They're very important. Yeah, and everybody, including children, should be wearing sunglasses. We get an unhealthy amount of ultraviolet radiation at the altitude we live at in a sunny place. And so it's also really important with summer coming up for people to protect their eyes when they're out using their lawnmowers or their weed whackers. I just grimace every time I see somebody out there without the eye protection on using those things because they fling rocks and hard things around at really high speeds.
Sure.
You've seen some horrific injuries
You
from
get people
those.
coming into your office and you're right, just like something shoots up, hits you in the eye, it can do a lot of damage.
Absolutely.
You said eyes are a sensitive area. Folks can find out more about you, all the vision correction and vision health. Go to our website, casa.com, click on the CASA blog. Dr. David Bernitsky, thanks so much for coming in and sharing.